Hello, everyone. Welcome. Okay, for today podcast, very excited. We have a very good topics to address and related to GLP-1 and the clinical perspective and topical and oral fat loss interventions. So today I have the pleasure to have with us two great people. We have Dr. Brad, our clinical director. Hello, Dr. Brad. How are you?
I'm doing awesome.
Awesome. And also have Edward Acosta, VP of Biopharma International. Hello, Edward. How are you today?
Good morning. Hope everyone's doing well.
Exactly. So welcome to everyone to today's podcast live. For any of you that is going to watch this podcast recorded, that it could be either through Zoom replay, or some of you are going to see it through YouTube. So if you're watching it via YouTube, I mean, it's part of the protocol to say to subscribe and make sure you give a thumbs up. It's going to help the YouTube little algorithm on the back so that the information can go far and wide. So would be really appreciated. So again, Dr. Brad, okay, so let's start with you. So GLP-1 and fat loss intervention. So there is a lot of talk out there with people that are using GLP-1, Ozempic, and other stuff related to GLP-1. Kind of seems the talk of the town. Every time you go on the internet, you see some promotions about it. So here's one question, right? Is from a clinical standpoint, I mean, obviously, you know better than me because you work with our clients every day. Like a lot of them, they have patients that come into their practice requesting for weight loss and weight loss solutions. But with the trend of the GLP-1, a lot of the clients, a lot of the patients, they have very high cost, side effects. So in your perspective, why a GLP-1 medication, not normal GLP-1 production, often falls short from being a long-term solutions, especially if somebody that is a patient come to one of our practitioners and want to have like a natural solution?
Well, the main issue is the product, the GLP-1 is going to work very well for the vast majority of people, but it won't be a long-term solution because they're just looking at the weight loss, but they're not looking at how did they put on the weight in the first place. So now they stop.
Right.
So now they stop taking it. They still have their old habit patterns built in. They still eat the same thing. And now the body converts everything they eat to fat again, and then they put it on. And my understanding is or they lost 5 pounds, now they're going to put 10 back on. I've seen this over the last 50 years in practice. Lots of things have come and gone to help people get rid of weight. But when they stop doing that thing, that was short-term solution, they put on double the weight, and then it was harder to get off because of the way the body's biochemistry works. So I'm not necessarily against the GLP-1. I just like a little more natural solution that makes it a long-term. Because the one thing people need to do is just improve what they're eating. Don't eat all the foods that put on the weight in the first place.
Totally, yeah. So obviously we're going back to lifestyle choice and basically maybe GLP-1 can be helping to go over the bump, but need to be follow up, I guess.
Yeah, that's true. And the more research I do into the GLP-1, the more and more I'm seeing some side effects that people aren't going to like. So it'd be good to minimize all those too.
Yeah, totally. That's very, very true. All right. So Edwards, again, my friend, how's it going? How is Miami, man? How's the weather there?
Erratic rain all the time, but what are we going to do? In the winter, we love it. In the summer, not so much.
I know. Just we got into the thick of the rainy season.
As
Anyway,
the
so
hurricanes stay away,
Edwards,
we're good.
yes. Now, okay, so BioCell International, like, which is connected with the productions of this product. So from a manufacturing point of view or perspective, right? How this product, the cellulite dystroph cream and capsule, because like we have a combinations here, right? How they team up to fight early obesity sign like poor blood flow and inflammations and and obviously while supporting natural long-term weight balance. How is this differentiated from GLP drugs that is more suppressed like the appetite?
The way to best look at it for your practitioners and more in line with what Dr. Brad just said, we're dealing with two things. As practitioners, you guys are going to deal with people that are taking the GLP-1s and they're going to have shortcomings. And that's where our products can come in and help. Or we can have people that'll do the nutrition route that won't be the quick fix, that will remedy the situation long term and continuously. And then we can also complement those patients. How do we do it? There's different ways of complementing weight loss, and these products are very good at it. For example, you address the weight loss in layers of fat. The GLP-1s therapies will suppress the appetite. They'll slow gastric emptying, improve insulin sensitivity, and stuff like that. But we have slowed metabolism as an effect of this. So the cellulite oral can help us enhance that metabolic efficiency. It'll sustain fat oxidation and protect lean muscle mass, where the cellulite topical will have stubborn fat deposits in skin with caffeine that we can target. We can target those areas with the cream that'll be susceptible, especially with these GLPs. You have that rapid weight loss, so we lose a lot of muscle mass and we have a lot of flaccidity to the skin. This is where another product that we won't be talking about today, but to consider is Juvensa, which helps with the elastin and the elasticity of with the collagen production. You're also going to have cellulite oral helping prevent your metabolic slowdown. It's going to support mitochondrial function, fat oxidation, and energy production. So it'll keep you with high energy rates, and your metabolic rate will be increased to counter-rest the effects of the GLP-1. We can improve aesthetic outcomes, like I just said. With the cellulite topical, we can reduce cellulite, tighten skin, and improve trouble areas that you might find people finding lack in their volume due to the rapid weight loss. We can help enhance patient satisfaction and adherence. There are side effects from the GLP-1s that we know, like nausea, fatigue, and that's going to be challenging. Cellulite oral delivers antioxidants and nutrient support through different components, reducing oxidative stress and stabilizing glucose, which improves our energy levels once again. A lot of these people with GLP-1s are going to get lethargic and whatnot because their energy levels will be depleted. And that's where the cellulite oral will help complement greatly. And the topical helps give patients fast, visible improvements, like we've said. We target the trouble areas and make it progress better in those trouble spots. It would be a complete 3-layer protocol. Both of our products with either nutrition, which is our first choice, getting the patient to eat correctly and establish the weight loss in a healthy way, natural way, or the GLP-1s that we know will help with that rapid weight loss, and will help with the orals, enhance metabolic functions, and with the topical, improve those trouble areas. GLP-1 will deliver the weight loss, is the way I like to look at it, but Curavital and cellulite will deliver quality of weight loss, preserving metabolism, tightening skin, and refining body contour. That's the gist of it.
Nice, nice. Yeah, it's interesting you mentioned about the rapid weight loss, they create like also problem with the skin and so forth. I was reading an article actually pretty recently that there is actually a new term that has been going on, which is the Ozempic phase, I believe it's called, or Ozempic body, where there is so much weight loss that now you have all these skin, droopy skin, or due to the loss of muscle, so forth, to the point that the article actually was, I forgot who wrote it, but the article was talking about that within the last year, there is being recorded a 20%, 20 to 25% increase in like a surgical, like, kind of aesthetic surgical type of procedure to handle this problem. That I was like kind of shocked, kind of, wow, that's amazing. Like, so the cream, you were saying that is a little bit kind of the cream process. I mean, it's not going to avoid that, but it's going to curb that scenario.
Especially in your gluteus areas and stuff like that, where you have the cellulite deposits. That's where we find it to be most effective. In the belly area, in the face, we recommend not using it as much, just
Yeah,
because of the thermogenic components of the products can
yeah,
cause a little discomfort or whatnot, and people a red face and stuff like that.
right.
It'll
But
be
you mentioned that
counterproductive.
I'm sorry, but you mentioned that you have another product, which is the Juenza, that kind of address more the face, right?
The face, yes, because it'll promote elastin and collagen production,
Yeah,
helping that flaccidity you're talking about be remedied.
right. Well, I guess that you already know what's going to be one of the next podcast about.
Good. Looking forward to it.
All right, all right. Okay, so Dr. Brett, question for you. I mean, Edward already touched upon, but from a clinical perspective, let's talk about a little bit this dual action approach, right? More from a point of view of the inside out, like, so you have the capsule, so it go to address the body from that perspective, and then the cream, which is from an external point of view. So how is this sort of approach, this dual action, how is going to help practitioners, that is going to help the patients to their weight loss journey?
Well, primarily the thing to do is not only get a good health result in the patient, but make sure the patient's happy. Because if you got an upset patient, they're not going to come back and they're not going to follow through, and all the ramifications of that's going to be, if they're not happy with you, they're going to go out and talk to 69 other people and tell them they're not happy with you. So that's just the statistics of it. So not only do we want to help them lose the weight because it's healthier, it improves their circulation, it takes the stress off the heart, takes the stress off the kidneys, takes the stress off the liver, and we want to make sure they're looking good too, because if they got droopy, saggy skin, their skin gets that little grayish look when it doesn't feel good. That's not going to be a good, very good advertisement for your clinic if you're trying to help people lose weight. So it's got a dual action. One is patient management, the other is clinical. So
Totally, that makes total sense.
And as I always tell my practitioners, only about 5 to 10% of what we do is clinical. The rest is patient management. So we want to help people. We want the people to get healthy. We want them to lose the weight. We want them to also stay with us long enough to get the results. The issue I've seen over the years is patients are looking for fast. I want to take a pill. I want to take a pill today, and I want to lose the weight tomorrow. It doesn't work that way. We got to change the body physiology, and the thing to understand, no matter what you're doing, it's still going to take 3 to 6 months to convert your body from fat storage to fat burning, no matter what protocol you're using. It's just that I've seen the cell disrupt work extremely well when I start pairing it with the bioenzyme product from Edward, because the body needs some enzymes to help process everything in their gut anyway. So
Totally.
that's a whole nother discussion we can have, but I'm been extremely happy with the Celdestrop on getting people to lose weight. And as long as you, patient management wise, you counsel them to improve their diet in the first place and not look for fast actions. You know, people want to take the pill today and lose 5 pounds tomorrow. It's not going to happen. So it takes really good communication skills along with really really good products. And I've loved this product line since the day Dr. Hewlin found it and opened it up to us. And I've been working with Edward now for several years. So thank you very much, Edward.
Pleasure. Loved working with you, Dr. Brad, all the time. Been a great relationship we've created over the years. Looking forward to many more years of it. And yeah, it's a lifestyle we're promoting here. It's not a quick fix. It's
Totally.
you. That's why the group is so resonates so well with our company. Your premise of all health is nutrition based, and proper nutrition and correct life choices in those areas will help be healthier. We just help assist with the little bumps in the road that might come from individual metabolism and whatnot.
Absolutely, totally. And by the way, just a little shout out to some of the people that are here live from. We have somebody from New York, Minnesota. So welcome to those people. And also we have some questions. So I will come to those questions. And any one of you that are here live, definitely you're welcome to send your question. Dr. Brad, another question here. From a clinical perspective, how stimulating the lipo, one of the result of this product is the stimulation of lipolytic enzyme and reducing of fat absorption, and also enhance microcirculations, how this is going to contribute to the weight loss and the obesity prevention in a way that is more natural than just the GLP injection.
Well, I've discussed this for those people out there that I can't see that have been in my classes. We already know there's this thing called the Krebs cycle, and the end result of eating sugar and refined carbohydrates through the Krebs cycle is fat. So we like to do it more naturally. From what I've read, the procedure out there blocks the body's ability to make the fat in the first place, or at least slows it down. And I would rather do it naturally than artificially, just personally, because I'd rather have the weight loss be a permanent thing, not come back on. So I haven't done enough research on it personally. Just the research I'm having, I just see all these side effects. You know, they keep talking about the side effects of kidney problems, feeling like you have the flu, irregular heartbeat, the thyroid shutting down, like Edward mentioned. That's why people run out of energy. From my viewpoint, when that happens, also you don't think well. And one of the processes that they keep talking about is mood changes in people.
Yeah, that makes sense.
And also a major issue that's already pandemic around the planet basically is constipation.
Yeah.
So if you're constipated, it doesn't matter how much weight you're losing, it's stuck in there, and now your body's reabsorbing all the toxins. So let's keep the bowels working too.
Yes, that makes total sense. And Edwards, going back to this dual action and so forth, from your standpoint, like more the product, like talking more about the product, can you tell us, excuse me, can you tell us a little bit more about the science behind the product, some of the ingredients and how those work to this journey of weight loss?
Sure. Both products have pretty much a five-fold formula that they wanted to achieve. With the oral, let's start with the oral. We want components of fat metabolism and oxidation drivers. Those will be enzymes and amino acids in the formula. Appetite and satiety regulators that would help people feel full and suppress the appetite, all natural stimulants to do this. Thermogenic and energy activators. So we want to get the metabolism going and speed up the body's functions to burn fats and consume the energy, the food and turn it into energy. Blood sugar and insulin sensitivity modulators. Part of weight loss is keeping a nice balance with the pancreas and the insulin we're burning and producing, and the insulin we're producing, better said, to combat the glucose we're consuming, and cellular health and anti-inflammatory support. Everything we're seeing nowadays in medicine has an inflammatory component to it. So all of our products are always looking to combat that subclinical and chronic inflammation that the body can accumulate. Many of our digestive issues, like Dr. Brad was saying, can be directly contributed to these high inflammatory rates we see in patients today, due to all the stuff we're being exposed to on a daily basis in the real world. So why does it work? Because it combines systemic fat oxidation enhancers, the appetite suppression, metabolic activators, your blood sugar stabilizers, and cellular rejuvenation. It's a multi-pathway formula that's going to help you have weight loss, but also help the body achieve that homeostasis that balance that nowadays our bodies are just lacking due to diet and external factors, stress, you name it. For the topical, they were more of a aesthetic approach, systemic to trouble areas, lipolytic fat burning activators, all topical, thermogenic and metabolic stimulators as well, micro circulation lymphatic boosters. So the lymphatic system being clear and cleaning out all these byproducts of what we break down with the thermogenics, skin firming and anti-cellulite peptides. So that's what we want to achieve. We want that firm skin and remove the cellulite and the troubled areas, the flaccidity we already spoke about. And then we also have topical antioxidants to help with free radicals that might be accumulated.
Great, thank you. Now, actually, I want to, Dr. Brad, I have a question that from Catherine. She's asking, are there drug interactions? I have a couple of clients on hydroxyzine, but would love to do this program fast and effortless. Any advice?
Well, the issue is, I'm going to take it right from the literature from the company. It just says contraindications. Seldestrov oral is 100% natural product and is well tolerated. It has not been observed any side effects at high doses. The product can be used safely. Sometimes could be associated with lower zinc absorption due to a decrease in the tetracycline. So they're not quite recommending the product when people are on like a beta blocker.
Right.
Is that right,
Okay.
Edward?
Yes.
Thank you. Appreciate it. So, Catherine, there you go. So I don't know if there is any more question, but I have another one that is kind of along the same line, Dr. Brad. For practitioners that already offer nutritions, right? And so they are already doing their own nutrition protocol, whatever training system they're using. How would you recommend they go about implementing a system like cellodystroph? And do you think it's better as a standalone program or as an add-on to existing care plan? Based on what you know about this product and the challenge that practitioners run into, what do you think would be a better approach?
Well, again, if what you're doing is working, don't mess with it. That's my first statement. And so
Sure.
if it's not working, now this is just an avenue. Don't jump headfirst into it in the first place. Let's apply it a little bit sensibly. If you got something working, keep doing what's working. If something's not working, now it's time to change. So for those of you out there that I can't see that knows things like blocking and switching, remember, for a person that has blocked regulation, their autonomic nervous system won't accept anything in the first place. So that's your starting point, is just to see what can we do to turn the nervous system back on so we'll accept what we're doing. And I would, since this is a kind of a new product line for many of you, the first thing I would do is I would just take one or two trial people, maybe even the practitioner and their spouse or family or their office staff. Let's do a trial program to see actually how it works with them. So you get your feet wet, so you actually know what you're doing. And then most of our patients come with us with health issues in the first place. So don't set those aside and only do the weight loss thing. You have to combine the two, because many times the health issue is based on too much weight, and too much weight is based on the health issue. So you got to coordinate everything all at once. So don't throw the baby out with the bathwater.
Yes, absolutely. Yeah, please do not. Like obviously, this is offered. This information is offered as a tool to consider, and definitely it's not meant to be that whatever you're doing is not working. But you obviously, each one of you need to evaluate the scene, and obviously any of our students, if you have further questions to your scene, obviously you can reach directly Dr. Brad with your clinical questions as usual. Edwards, from a practice owner perspective, how does stocking on product like this could create like also a new revenue opportunity, but also like create like an additional retention for practitioners, because again, kind of maybe there is that extra little tools that can help to achieve even a better result.
Well, I mean, obvious reasons. Who do you know that wouldn't like to lose a couple of pounds? So if you can give them that component and have a solution there readily at hand, it's something where there's a million things out there, and 2 million come out every day, and then 3 million go away, and then we've lasted the test of time. So it's still being produced. It's been produced now for over 15 years. Is it a magic bullet? No. But will it help? Yes. And keeping in line with the message, the UNS message: nutrition, exercise, and the supplements. Don't sell it as a magic bullet. Sell it as a component to assist in the process. One further thing to keep in mind when commercializing the product and whatnot: vanity is a component of this product, and vanity is an easy sell, but it's a difficult deliver. Never overpromise with the product or anything like that. Be very reserved in what you promise, but be sure to say it does work, as long as the client or the customer will do their part and comply to diet, exercise, and lifestyle.
Yeah, well said, well said. All right, well, I guess that we are toward the end here. Dr. Brad, in one sentence, like what is the single most important message that practitioners, regardless if they are nutritionists, chiropractors, or could be maybe somebody that is new, or maybe somebody that listen here could be also not in nutrition yet at all, could be a med spa or you name it. So in general, like across the board, like I know that is a bit broad, but what could be a takeaway that you can give out as a message to other practitioners in order to elevate their helping their clients with their fat loss or weight loss protocol journey?
There's no magic bullets, and slow and steady wins the race.
That's right. Well said, well said. And Edwards, also for practitioners that are listening today that want to expand their toolbox, what would be the first step, and how easy it is to get started with this protocol or with this using these products in a practice.
The risk of being told I'm not original, I'm going to go with Dr. Brad's original thought. Use it
Yes,
yourself. Find someone in the office to test it. Find yourself if you need it, and give it a true trial in office, and it will help you even sell it later on because you're going to see the results and you're going to be able to speak to those results.
absolutely. Well said. Very good. All right. So, well, consider we talked about these two products. Like I wanted to show it to people that are watching this. So the products is coming. These are the two products. One is a cream that is coming in this box. Very nice. Very produced. Actually, this is produced directly from Swiss. And then the pill, the capsule is in here in this box, and this is how many capsules in one box, Edward?
60 capsules, 2 daily,
And
30-day
and
supply.
30-day supply. Great. So here we go. So this is
Yeah,
a
of course,
30-day
sorry,
supply.
Dr. Brad, you guys muscle test, so your dose will be different than mine, but my
Yes.
dose is 2 daily for 30 days.
Yes,
Well, that's
totally.
my recommendations because I don't, there may be people out there that don't use our procedure. So just go by the bottle or the package directions. And somebody asked about this blurb sheet. This is what's inside the box when you get the cell destruct.
Yes, exactly. So I see here a question from Laurel. She's asking, how do we get a clinical reference or protocol if we want to try on ourselves first before introducing to our clinical practice? So I guess that too.
That was from Laurel.
Yes.
All right, Laurel ACT7 manual.
Yes. But in any case, Laura, like you can reach out to us. She's answering, ha ha ha.
Yeah, that's I verbally poked her with a sharp stick.
Yes. But in any case, Laura, like reach out to us. We can definitely send you the protocol that is inside the box and with the recommendations from the company. Also, is a question from Kissy. Will people need to supplement with zinc?
And that's in small cases that it'll deplete zinc levels in some people. It's not a general caveat that we have to be looking out for or anything like that. Just something to monitor when you're starting the product, because some people do report a little dip in their zinc.
Okay, that's a good things. Also, there is another questions. Wow, that's great. Like we have more questions coming. Can type 1 diabetics use this product?
I mean, they can, but the issue here is more of a pancreas issue. So I would be more inclined to use a rubber cell,
Yeah,
or the Cellulite 2, going back to the biocell products.
that's right.
No problem. Okay, appreciate it. Rick is asking, can I get a detail sheet first? Yes, absolutely. No problem. We can send that to you. And then we have a question. Another question. You mentioned I have a different set of clients who many have significant abdominal scars along with extra fat. Will the topical still be effective?
Will not be effective on the scars. We have a product coming out. I don't promise dates anymore because I've gotten burned in your groups promising dates. But when the Juvensa topical does come out, that'll help with those scars. But as far as the fat burning aspect of it, it will not hinder the scars and it will help with that.
Okay. Awesome. Appreciate it. All right. So I feel that we have exhausted all the questions. So one more thing, just in relation to these new products. If for any of you that would like to buy some or try, we actually have on our store as a bundle. And so if you buy as a bundle, actually is you save a little bit than rather to buy individually. So, and there is also a discount, a quantity discount. So as a bundle, just a small quantity, there is a 10% discount, but you also, if you want to, if you, after you try a little bit, then you want to kind of stock up, there is even a higher discount. And for questions, price, and so forth, you're welcome to reach out to us and we'll be happy to give you all the specifics. Otherwise, again, Dr. Brad Edwards, thank you. You've been lovely as usual. You've been super enlightening and super informative, and I'm sure that people would love to hear more about it. And if for any one of you that listening, like we definitely we want to have your feedback after using the products, and then by the way, we just dropped a link with the bundle on the for any one of you, and it would be we're going to include the link also for the replay and in the YouTube video. All right, well, again, thank you, and have a great day.
Hold on,
Thank
Danielle.
you all.
Yes.
One last thing. To get a
Yes,
hold
sure.
of me, it's the word clinical@unsinc.info. Whether you do nutrition response testing or some other method, you can always ask me clinical questions.
Yes, absolutely. Absolutely. So again, is clinical@unsinc.info. Okay. So, and we drop in the email here, and then we'll be happy to answer any clinical questions. All right. So again, thank you. Thank you so much. Thank you for your time. Thank you for anyone that listening for being here. Again, see you to the next live podcast. Bye.
Care.